Skin cancer is a common and potentially deadly group of diseases wherein malignant cells form in the tissue of the skin. Early signs include new growths or sores that won't heal, changes in existing moles, such as irregular edges, increase in size, changes in color, or asymmetry. Symptoms can also manifest as persistent patches of redness, itchiness, or bleeding on the skin that refuse to resolve over time. Treatment varies from surgical removal of the cancerous tissue to radiation therapy, chemotherapy, or targeted drug treatments, depending on the type and stage of the cancer. Individuals with fair skin, a history of sunburns, excessive UV exposure, or a family history of skin cancer are at a higher risk of developing the condition. Here are detailed aspects of skin cancer, delving deeper into the nuances of its types, progression, and the importance of early detection and prevention. Symptoms and progression of skin cancer. Skin cancer often starts as a subtle change in your skin, potentially becoming a life-threatening condition if left unchecked. The most common types, basal cell carcinoma and squamous cell carcinoma, typically develop on sun-exposed areas, manifesting as a pearly or waxy bump or a flat, scaly, reddish patch, respectively. As these cancers progress, they can become more pronounced, leading to skin discoloration, bleeding, and ulceration. Melanoma, the deadliest form, is more likely to grow quickly, showing up as a new, unusual growth or a change in an existing mole. Key warning signs include asymmetry, border irregularity, color variation, diameter over 6 millimeters, and evolving characteristics over time. Early detection and treatment are crucial, as skin cancer can metastasize, spreading internally to organs and becoming increasingly difficult to treat. Periodic self-examinations and professional skin checks are essential prevention measures. Diagnosis of skin cancer. Effective diagnosis of skin cancer hinges on early detection, greatly improving prognosis and treatment success. Dermatologists typically employ a combination of visual examination and dermoscopy, a non-invasive technique providing magnified, illuminated views of skin lesions. For suspicious growths, a biopsy is the gold standard, where tissue is excised and examined microscopically for malignancy. Advances in technology, like artificial intelligence and machine learning, are being integrated into diagnostic tools to assist clinicians, potentially increasing the accuracy and speed of skin cancer detection. Recognizing changes in skin lesions, such as asymmetry, border irregularity, color variation, diameter over 6 millimeters, and evolution over time, is crucial advice directed at the general public to prompt timely medical consultation. Cause and risk factor of skin cancer. Skin cancer arises primarily due to DNA damage in skin cells, which is often a result of excessive exposure to ultraviolet UV radiation, either from the sun or artificial sources such as tanning beds. The risk is higher in individuals with fair skin, a history of sunburns, or a family history of skin cancer. Other risk factors include the presence of numerous or atypical moles, a weakened immune system, exposure to certain chemicals like arsenic, and advanced age. It is not limited to sun-exposed areas and can develop even in places typically covered by clothing, indicating that other environmental and genetic factors also play pivotal roles in its onset. Regular screenings and adopting protective measures against UV exposure can significantly reduce the risk of skin cancer. Treatment and management of skin cancer. Treatment and management of skin cancer hinge on the type, size, depth, and location of the cancer. For non-melanoma skin cancers such as basal cell carcinoma and squamous cell carcinoma, options include surgical excision, Mohs surgery for precision, or topical medications like imiquimod for early stages. More advanced cases might require radiation or even chemotherapy. Melanoma, a more aggressive skin cancer, demands a more rigorous approach, often involving a combination of surgery to remove the tumor, immunotherapy to boost the body's defenses, targeted therapy to attack cancer cells with specific mutations, and possibly chemotherapy and radiation. Regular follow-ups are critical to monitor for recurrence, and patients are advised to maintain rigorous skin protection to prevent further damage.